It's been about it's been about 15 minutes since we started treatment. And the pelvis looks much more symmetrical. I can take up the slack, so I can push, and there's a natural movement, and then it tightens up on the right ilium. And then I can add an additional force called a spring test, and it moves further and it bounces back, and I see your feet move with that. So the force is translating through the sacroiliac joint, down into the hip and down into the lower extremity. So that's better. Let's have you lie on your stomach.
Okay.
And the sacrum is much more symmetrical now. This is the left lower quadrant. And now I can push, and I can feel movement, I can see movement. Both of your feet move. And then I can spring it and both feet move again. So that's better. And now I'm palpating the tailbone. And that's now symmetrical side to side. And let's have you lie on your back, please. So I talked about the compensation, that the lower body oriented left, and so the upper cervical spine oriented to the left, to the right. I'm sorry, to the right. Yeah. So without even having treated the upper cervical, I expect it to be normal now. And I'm coming underneath the occiput and underneath each side of C1. And again, I lift it on the left, and now I lift it on the right, and it moves very freely. So yes, the compensation self-corrected, and it shows that we're on the right track. Do you want to step down and walk up and down the hall and then come and sit and see how you feel?
Yes.
So just walk down to the end of the hall and back, and then come sit in the chair. So balancing the pelvis is very simple and straightforward. There's many, many combinations of movement dysfunction, and those are illustrated in my book.
It's a nice chair.
But it's very, very simple, and the most common pattern of coccyx dysfunction I see is a side bent coccyx. So can you tell us how you feel?
I feel good. I have no pain right now.
Nice.
Yeah, no pain with walking or sitting or standing up.
Yeah. How quickly would you have hurt in sitting?
It usually takes like 2 to 5 minutes,
Yeah.
depending on the day.
So
yeah.
Alrighty. So we'll know when you come back.
Yes.
And so it should take me about 2 visits to correct you.
Okay.
And it should be very long lasting, based on my experience.
Great.
And it's encouraging,
Yes.
what I hear.
Yes.
And we'll do a follow-up film
Okay.
when I see you in about a week.
Okay.
So thank you for letting us film.
Great. Thank you.